The following Agio-supported podcast is intended for informational and educational purposes only and is not intended as medical advice. Please speak with your healthcare professional before making any treatment decisions. The guest, Tabatha McGee, on today's show was paid to participate in this podcast.
What's up, Cheat Codes listeners? It's me, Dr. Z.
And me, Dr. C.
Dr. C, we have a fantastic guest with us today, and it's somebody that we know. It's somebody that we actually got to meet at the FSCDR meeting recently.
Yeah, I'm really excited because that was the first time I met her, and I have so many follow-up questions.
Yeah, it felt like there was not enough time. It was not enough time to work through all the things that she's got going on. Of course, no stranger to the sickle cell warrior community, no stranger to the sickle cell space. We've got with us Tabatha McGee, who's the executive director of the Sickle Cell Foundation of Georgia. Welcome to Cheat Codes, Tabatha.
Thank you so much, Dr. Z and Dr. C. I'm really happy to be here.
We're equally excited, and like Dr. Callaghan was talking about, we got to dive in just a little bit. If you go back, Warriors, maybe a few episodes back now to our CBO Cheat Codes episode, we featured Tabatha as one of the contributors to that panel conversation where we started to hear a little bit about the Sickle Cell Foundation of Georgia, the kind of things Tabatha is working on with that warrior community and how things are innovatively building there. But we're really hoping to deep dive into that. And even a little bit more than that, I'm actually really curious about your story, Tabatha. How did this all build? How did you get into sickle cell disease? Let's start right at the beginning.
Let's start at the beginning. So I started at the Sickle Cell Foundation of Georgia April the 1st, 2015, as a favor to my mother, to one of her friends who was the CEO of the Sickle Cell Foundation of Georgia at that time. She needed someone to assist her with her systems. And so my background is a systems engineer. I worked at Xerox Corporation for over 13 years. I also had my own business, Complete Vital Solutions, which is an IT company providing IT solutions. So my mother said, my friend needs help with her IT. So I came over to the Sickle Cell Foundation of Georgia, interviewed with Deb, and she told me what she needed. And I was like, okay. And I was like, how much money are you paying? And I blacked out because I still don't remember what number she said. No, I do remember saying, oh, yeah, okay, I'm just going to volunteer here because you can't afford me. So we both chuckled. And so I started volunteering to clear up their systems and their network. And then about a year later, she asked me to come on board as a part-time employee because she really liked what I was doing. And at that time, I fell in love with sickle cell. I fell in love with what they were doing, the warriors that we were serving, the mission, the cause, the community. I just fell in love with it. And I knew that I can add so much more value. And so I started full-time 3 years after that. And I worked my way up in the organization from systems engineer, IT, finance, human resources. I knew all the ins and outs of the organization. And October 1, 2021, I was selected as the new CEO. And so here I am as the new CEO of the foundation.
Wow.
Agios is a biopharmaceutical company that's fueled by connections with patient communities, healthcare professionals, partners, and each other. Building on these connections and the company's unmatched leadership in PK activation, Agios is pioneering therapies for rare blood disorders, including sickle cell disease, thalassemia, and PK deficiency. To learn more, visit us at agios.com. That's agios.com. To join the conversation with other patient allies, follow us on Instagram at Ally Voices Rising.
Let's take that back even more. Let's go back before Sickle Cell Foundation of Georgia was even on your radar. Where's home for you? Where did you grow up? And tell us a little bit about your path to the Xerox company and then your own company. I want to hear a little bit about how you built all of that.
Whew, you're taking me way back. Okay. So I was born and raised here in Atlanta, Georgia. I started from high school in the military. So I served in the U.S. Army. And I served the entire time of 7 years over in Germany.
Wow.
I actually am a paratrooper. I jumped out of planes. And from there, I had a family. I was married. He was from DC, so that's when we moved to DC. And I was in DC and I worked at the American Red Cross in their social services branch. And then I worked, where did I go after American Red Cross? Oh, the Education Trust. And from the Education Trust, I ended at Xerox Corporation. And I stayed there until, unfortunately, my son got sick. So I had at that time, a son, a young teenager that was diagnosed with epilepsy, and he was challenged with the epilepsy. And they told me that he probably did not have that much longer to live. So I did resign from Xerox Corporation and went to become a caregiver for my son. 8 months later, he did pass away, unfortunately. And so after he passed away, instead of going back to corporate America, I felt that it was time for me to start my own company. So Complete Vital Solutions came on the scene. I started providing services to the very customers that I was calling on in Xerox and installing networks and becoming support system for IT. And I was doing extremely well there until I got a call from my brother and said that my mom here in Atlanta needed some assistance. She wasn't feeling that well at the time. Hence my story. I came to visit February of 2015, and something called God called me home and said, you need to move home. Your mother needs you. So I relocated in 2015. I went back home, shut everything down. My kids was grown. It was just me. It was perfect timing for a move. And so that's how I ended back in Atlanta and at the Sickle Cell Foundation of Georgia.
Wow, there's so much to unpack there. First of all, so sorry for your loss. That's the ultimate loss that anyone ever has to deal with, so I can only imagine. But I think it adds so much depth now to the idea of the advocacy you're doing, to have that caregiver experience. I see Dr. Callaghan's got a lot of questions because I saw him writing down furiously. Dr. C, why don't you just jump into whatever your first thoughts are? I know paratrooper is going to be on that question list.
Amazing story. I think you wouldn't think of this as like the route to being CEO of a CBO, but I imagine like leadership training you get in the Army is amazing. Working at Red Cross and getting some exposure to blood and blood components fits in, and then working in a big organization like Xerox and understanding that, but then going out on your own and building something from scratch. I can imagine all of those things contribute to what you do now and make you a great leader of this CBO. Can you speak to some of that? How do you draw on those experiences?
I think you're absolutely right. When I look back at my life and I take an account of my life, everything that I went through provided the experience. It provided the leadership. I was a caregiver, so I understand sickle cell warriors, their caregivers, and what they have to go through. I understand the caregivers as well, having other children that they have to help during the process while you're taking care of a child that's sickly. I drew on the experience from the Airborne, 82nd Airborne in Fort Benning, Georgia. You had to be so analytical and so detailed with everything, because if you didn't button up and zip up and snap up every single item on your uniform, you could jump out of the plane and die. I built on my training inside of Xerox was because they sent us to school for 12 weeks in Virginia to ensure that we knew all the processes of the system before we even became a full-time employee with Xerox. They wanted to make sure we was trained and tested and we understood the information before we could become a person that could sell solutions. I took on having the drive and the initiative in the military. You're going to wake up every morning at 3 a.m. You're going to exercise. You're going to eat well. And that prepared me for my own company, understanding that even today, I still am a 4 a.m. girl. I'm out of the bed by 4:30 a.m. And so I am a self-starter. I don't need someone to tell me where to be, when to be. I am very creative. I am a hard worker. I am very strategic in my thoughts. And I write everything out. I write the plan and I make it clear. And from there, I'm a risk taker. I don't mind failing. Fortunately, I have failed backwards, but most times I fail forward. All of those experiences do lead to where I am today. And I've had to face my own health challenges, both a heart attack and a stroke at 45 years old. And from there, I was recovering for about a year, going through rehab. And once I finished with rehab, inside of that process, I was exposed to holistic healing and care and never thought about it, just going through the process for myself. But I remember how great it made me feel. I remember the difference I felt by going through getting traditional care coupled with holistic care that really allowed me to bounce back very fast. And I consider even better than I was before. So, yes, I have built where I am based on all of those experiences. And it wasn't a easy journey. A lot of people, you hear the old saying, they want your glory, but not the story. So a lot of people don't understand what I've had to go through to get to where I am today. And I now believe I had to go through everything that I went through in order to get to. I had to become a person that experienced what our sickle cell warriors are experiencing, our caregivers are experiencing, in order to have the empathy and the compassion in order to serve in this community. Because without your heart leading first, without having the compassion, without having the empathy, you would not be able to serve well. And even if you did serve, you wouldn't make connections. And I would love to say that I am well liked in our community. The sickle cell warriors know that I care. The sickle cell sanctuary is an indication of how much I care.
Yeah. Well, yeah, I can tell you from our standpoint, we're here for the glory and the story because let me tell you, the construction of the story and the arc of this story, the way that things were built seems truly like it was building to this ultimate mission. It really feels purposeful, as though you were being guided to do exactly what you're doing in this moment. I spent a little bit of time in preparation of this episode looking at the website on Sickle Cell Foundation of Georgia, and I've got to say, I have met a lot of people who run a lot of CBOs. You guys are doing a lot at the Sickle Cell Foundation of Georgia, and I want to touch on the sanctuary, but before we even get to the sanctuary, why don't you tell us a little bit about the local sickle cell community that you serve?
So the community that we serve are our sickle cell warriors, our caregivers. We also serve our providers because providers need education. Providers need the organization in order to tell them what's happening in the community and what our warriors need. We serve our warriors, we serve the caregivers, we serve the providers, and we also serve the pharmaceutical companies. We educate them on the community and what they need. And we also connect them with the community so they can understand how best to serve the sickle cell warriors. So the community is very diverse. We have some millenniums, we have baby boomers, we have our young children, we have babies, of course, and then we have our elders, our seniors inside of our community. And we have they're very talented, they're educated. However, they're living with this horrible disease that's very painful. So that's our community in a nutshell.
So one of the things that did strike me, actually, and we rarely ever hear about the CBO's responsibility or influence on local providers. And the provider training that I saw that you offer to physicians is fantastic. Tell me a little bit more about that.
Thank you. That is a CME accredited course that we're in partnership with Morehouse School of Medicine. And we take that along with 2 hematologists. We have a care coordinator, and we also have a community health worker, and we have an executive assistant. And we take this around the state of Georgia and provide education. It's a 4-hour course, provide education to non-specialty providers. And the reason for that is because, as Dr. Z, it is not that many hematologists that is attracted to the sickle cell space, right? We have more that's attracted to oncology opposed to sickle cell. And so we realized that we were hearing over and over again from different providers when they show up in the emergency room, Tabatha, or they show up in our small clinic, we don't know what to do. We don't know how to help them. We don't even know the first thing about sickle cell. So when they told us that, we was like, yeah, we could do something about that. We have some phenomenal providers that are educators. They love teaching. So let's see if we can put something together. And we did. And then once we put it together, we went to Morehouse School of Medicine to see if we can get it accredited. They accredited, so they get 3 CME credits for this course for the completion of it. And it is a hit. And so we actually are teaching in September at the Aflac Cancer Center down in Noonan. And so many of our major hospitals around the state of Georgia, everywhere, even in the rural areas, are now calling us, asking us for this course. And we're in the process, but we're in the process right now of actually putting this same course online in chunks of smaller bits of time so that more of our providers can provide, because it's very hard for them to get away for 4 hours at a time. But when we break it down and we put it in 30 minutes, then they can pop online, log in with the username and password, take the course, and when they successfully complete it, they would then get a CME credit on the back end of it. So that's the provider training.
That's fantastic. Do you have to be from Georgia?
No, you do not have to be from Georgia.
When this online one comes, they could go to your website and sign up and access. That's great.
Absolutely. They'll be able to go to our website and they'll be able to take it there. We're in the process of discovering and evaluating 2 different applications that we have seen that would allow us to put the recordings online.
Honestly, I'm just blown away by that. There are so many local communities that could benefit from this service. So I'm happy that it's going to be more widely available, because you're right. We just don't have providers that, I'll even go as far as saying they may care about sickle cell disease, but they just aren't equipped with the tools that they need to know what to do, to understand the nuances. So this is just a huge service that you're providing. Thank you so much.
Yeah, you're absolutely welcome. Yeah, we're really excited about it, the provider training. And we know that inside of provider training, because every 2 years we go in and we update it, we're very excited about the therapy side of it that we're getting ready to add to it, which is all about gene therapy, because many people, many doctors don't understand it. So as a result of it, when our sickle cell warriors are going to ask them about it, they're saying, I'm sorry, I don't know much about that. So we realize that's another educational piece that we need to add to the toolkit.
Yeah, so important to keep up to date on clinical trials and new developments, new therapies. Absolutely. Go ahead, Dr. C.
I was going to say one thing that stuck out to me at that CBO panel. Lots of people have good ideas, but part of executing them is bringing the resources. And it sounded like you found ways to pull in resources and really develop innovative programs that could be a model for other CBOs and the rest of us, really. I remember you saying you raised quite a bit of money from the state of Georgia. How have you been going about doing that?
That's all about writing, grant writing. We have a phenomenal grant writing team. And so we as a company, we became very strong at mind mapping what we needed, the what, the where, why, how are we going to do this? And we were able to address each one of those questions on the mind map that we did. We put it on a large bulletin board in a large conference room, and everybody bought into, number one, the vision. Then everybody bought into the plan. And then, as you said, Dr. C, it's about execution. So we were able to assign different roles to different people in the organization to get things done. And then weekly we were having meetings until we knew what it looked like. And then I went and wrote it. So I wrote the executive summary and the business plan for what we wanted to offer over the next 3 to 5 years, what we wanted to focus on. And so as a result of that, many things came to life. And another one of those great programs that we have here at the foundation, I can't take credit from this one, because Jeanette Newman actually put this program together as transition services. And one of the problems that we were having in our community is young adults transitioning from pediatric care to adult care. And once they became adults, they were really lost. They didn't know what the processes were, the systems were, and how to navigate through to get the resources that they needed. So we put together a transition program that is really doing exceptionally well now. And it addresses 3 different age groups of individuals that are transitioning. Most people was starting to focus on the transition from 18 up, but we really wanted to start teaching them as young as 7 years old how to transition and how to take ownership of their disease, how to take ownership and understanding of how to identify when they need to rest, when they need more water. So the transition series is very popular here in the state of Georgia, and it's doing really well and it's growing. Then we have our mobile health hub, which is a mobile clinic on wheels. So we take the mobile clinic to our rural areas, Augusta, Columbus, Macon, Savannah, Hinesville, and we actually treat sickle cell warriors where they are because the number one problem that they have is access to care, getting the care they need. And so now our driver, our doctor, our nurse, our community health worker, we're in the field seeing them where they are. So the mobile health hub is so beautiful. It's well designed and wrapped, and it's a clinic on wheels. And so we've been able to do hematology care, sickle cell testing right there inside of our mobile health hub. And then we have our camp, Camp New Hope. And Camp New Hope is an opportunity for children that is ACA certified, is 24/7 medically supervised. It allows children as young as 7 all the way up until the age of 17 to experience a 1 week overnight with camp counselors, and our camp counselors all have sickle cell disease. So they're able to teach them, they're able to help them transition, they're able to have fun for a week. And it also gives those caregivers, the mom and the dad, a week off. It also gives the other siblings a week off. It gives them an opportunity now to rest, catch up, go out and have some fun with the other children while their children are being taken care of in a 24/7 medically supervised space. And so the kids have a lot of fun. We did a back to school drive, coupled with our camp this year. It was incredible. It was a lot of fun.
How long is that camp? Is it a 1 week?
It's 1 week. It's 6 nights and 7 days.
So all the campers and counselors are all there at the same time?
All there at the same time, yes. And it's a phenomenal, it's amazing. They have talent shows, they go swimming, they do zip lining, they do inside board games. The transition program is taught there. We teach them about financing, budgeting, we teach them college life. I mean, it's so many different subjects that we offer there in chunks of time that keeps it interactive, keeps it fun, but yet is an educational piece.
And I think the amazing thing about camp is the community it builds. The little kids get to look up to these role models who have sickle cell also, and then meet peers that have that, and then they grow up and become the counselors. And I know I was involved in another disease space camp like this where I start going to weddings and all of the groomsmen are from camp.
You are right, Dr. C. Our warriors, our friends. We have a warrior that started out as camp, and he's now married, and he's the director of the camp. And so it does create that community where they now are all friends. They hang out together, they go out together, they're able to support each other, even taking care of each other's mental health, which is so critical as well. When you're experiencing so much pain, that pain translate over to an emotional state. And so having each other, that builds strength.
Yeah, absolutely. One of the things that I love about Atlanta and that metro Atlanta, even the Georgia area, you have like an all-star cast of sickle cell advocates and sickle cell patients that are really dedicated to advocacy. And whenever I talk to anyone from Georgia area, Atlanta area, they talk about camp all the time. It is such a critical piece. It's like it's so knit into the fabric of that community. It's such a phenomenal job that you've done with camp. It's called Camp New Hope, right?
Camp New Hope. Yes, absolutely, Dr. Z. Thank you. Yes.
Okay. Now, we heard a little bit about the Sickle Cell Sanctuary, and I feel like we didn't hear enough. Talk us through what drove the idea, how you thought it through, why this was a need, and how things have been going, how the reception has been.
The idea came from my personal experience with some medical challenges. As I was stating, I had a heart attack and had a stroke, had many different prescribed medications that I was on. And because of those medications, I felt lethargic. I lost weight. My hair was coming out. I just didn't feel good. And I didn't feel good for a very long time. And through a suggestion of a friend, I went to a holistic center to get care. 6 months later, I was off all medication. My hair started growing back. I started gaining weight. I felt incredible. As I was sitting down thinking about the next 3 to 5 years in the community, and as I was looking in the community, what do they need and what's missing? And I realized the one component that was missing was holistic care. It seemed to me that the solution at that time to any indication of a crisis or pain or sickle cell was a pill. I absolutely believe in Western medicine. But I was like, let's give them another option as well. And I believe that I had a dream. And in the dream, I was in the holistic center getting care for myself, but I kept seeing sickle cell warriors. And I was like, okay, I don't understand this dream. And I prayed for God to crystallize it. And I woke up one morning with a smile on my face. I said, we're going to start a holistic center for sickle cell. And what I also realized was that the sickle cell warriors didn't have a place. Like they have Cancer Center of America, they have the diabetes, they have the Lupus Foundation, but we really didn't have a place here in Georgia for our sickle cell warriors. And when I went to visit different facilities, there was nothing carved out for sickle cell. Sickle cell at Grady is built into the oncology suite, but they do call it a sickle cell center, but it's oncology as well. So I brought it to the team. We mind mapped it, planned it, scratched the plan, put it on the board again. And then we started looking up all of the holistic services that was available and how might it aid in the sickle cell space. Then went to NIH, the National Institute of Health. They had some published articles about holistic and integrative medicine, integrative care, and what it would do and how massages could benefit and how acupuncture could benefit, how infusions and IV hydration could benefit, how mental health counseling can benefit, nutrition played a part in it. And I was like, okay, so we were set on the services that we wanted to offer. Now we have to find out how much it's going to cost. I'm a numbers girl. I've always been a numbers girl. I sleep numbers and I wake up numbers and I eat numbers and I drink numbers. I love numbers because if it don't make numbers, it's not going to make any sense, right? We all know that. You have to have money for the renovation, the build out, as well as the sustainability for once it is in place and once it's working. I was fortunate enough that we went and we wrote some grants and proposals to different organizations, the state of Georgia being one, other private foundations, other local organizations, and they all said yes. So now, once they said yes, and I knew where the money was coming from, I knew how much it cost, and they was like, yes, we're in. It was a matter of finding the team that could do the renovation and do the build out. And what I wanted was something that as soon as a sickle cell warrior walked in, the smell in itself would relax them. Because when we all go to the doctor, as soon as we walk in, what happens? We tense up, we get frightened. And so they take our blood pressure is automatically elevated because we're in. And they said, we're going to let you wait about 5 more minutes. Did you take your medicine this morning? Yeah, I took my blood pressure medicine. Okay, we're going to let you wait 5 minutes so your heart rate can come down. And they do it again. And so it's about environment. So I wanted them to smell it. I wanted them to feel it. I wanted them to sense it. And so I wanted to create a serene, a very relaxed space for them. I wanted something that would blow their mind. I wanted something that they knew when they walked in, we are cared and loved. And we have that now. When you see the Sickle Cell Sanctuary, I still get emotional every time I walk through those back doors because it's exactly what I had prayed for. It's exactly what I knew we could do. And so hence when I was saying serene and quiet and relaxing, that's what the sanctuary is. And I kept saying, I want to feel like a sanctuary. And it's like, duh, that's the name. And so hence Sickle Cell Sanctuary. And so the services that we offer is acupuncture, biometric scanning. The biometric scanning lets them know exactly where they stand with their body weight, whether or not their BMI is up. It tells them whether or not they're predisposed for diabetes. It does the measurements of the entire body. And so we know where you're starting from, right? And so we also have mental health counseling and therapies. We offer hematology and oncology care, nutrition and fitness counseling, as well as we have yoga on the line on Thursdays. Today is Thursday, yoga on the line. And so we are seeing now anywhere between 5 to 7 sickle cell warriors a day. And our goal is to increase that to 10 to 25 a day. And I have an unbelievable medical team. We have our holistic doctor, we have our nurse practitioner, we have our registered nurse, a phlebotomist, we have a sickle cell wellness director, as well as an office manager. And they managed the billing, they managed the appointments that you make all online. You could upload your medical files, your medical charts online. And so it's heavenly, it's beautiful. And our sickle cell warriors, they get emotional when they walk through those doors. And then the way they're treated with respect and dignity, because we heard over and over again how people would tell them, oh, you're really not in pain because you don't look like you're in pain. People would tell them that, and because they don't feel the pain. I wish there was some type of a device that it would transfer the pain level from one person to another person when someone said, oh no, you're really not in pain. I wish somebody could experience that. And so
The sanctuary sounds amazing. I want to come see it. Can we come visit?
yes, please. We would love for you to come visit. We just had 3 different groups of individuals here on Tuesday that just did a complete tour. We got many tours that's going on. People love the tour. Our open house was on June 18th. We had over 300 individuals. We did tours. We had a huge grand opening out back, a ribbon cutting ceremony. We had our state legislators that came out, representatives that came out. It was a phenomenal event. And then every local media channel here, media outlet channel here in Atlanta covered the story as well.
I'm rarely at loss for words, but this is just next level, Tabitha. The way that you have been able to construct so thoughtfully just a safe space for individuals living with sickle cell disease is unheard of. It's completely innovative, totally novel. Nobody is doing the kind of things you're doing. Even the way you've staffed the sanctuary, there's some CBOs that are working with 4 or 5 staff members for the whole CBO, right? You've got 4 or 5 people dedicated to the sanctuary, and then you're serving 5 to 7 warriors a day. That is incredible. We're talking 100 warriors a month.
Absolutely. And that's just for now. I'm limited by way of space. I have 7,000 square feet upstairs. And then when I moved, so our building is 14,000 square feet. So we got 7,000 upstairs where the sanctuary is. And then it's 7,000 downstairs. I have about roughly less like 42, 43 employees now. And we want to grow to 100, but we have a good problem. We're out of space. We're in the process of putting together a capital campaign so that we can raise funds for a new building. I want to have a new building. And so that we can build out the sanctuary and to make it larger to accommodate even more warriors. But this is a good start because it allows us to tweak anything that needs to be tweaked, to improve on any processes that need to be improved upon. And so I would say that by next year, this time, we probably will be seeing anywhere from 10 to 25 a day. And so I'm really excited about it. I'm very excited. I'm really excited for the warriors. And for those warriors that do not have life and health insurance, we see them for free. We provide those services for free.
That's absolutely incredible. So I've got to ask you, we're going to take a little side road here from the sanctuary. One of the things that strikes me about you is that you probably have an incredible ability to tell people the story of sickle cell disease and why they should care about it, right? That goes along with sort of this idea of being able to raise money, being able to get state legislators to come visit you. For those people who may be out there listening and trying to figure out how to get the attention of people when it comes to sickle cell disease, what advice do you have for them? What is your approach? How do you make people care about your local community that you're trying to serve?
Well, you have to show them what you're already doing. You have to have proof that we're serious about what we're doing. And so that's why when we did your earlier podcast, having people really understanding that even though they call it a community-based organization, we're a nonprofit business. This is a business that we're running. We spend money on marketing, on local radio, as well as the local TV stations to let people know about the different events that we're doing, let them know about sickle cell. So we do have to pay for those services. Sometimes we get a great discount. We have billboards. But you have to show people that it's a business that you're running. You also have to show them by the way you take care of your community. And our community love us. And so when they see the love, not just that we're given, but we're also receiving, it makes people want to care about this. And so I just go from the perspective that imagine if in any given minute or second, in any given day, you're feeling 100%. And now in the next 5 minutes, you have to be hospitalized for 2 weeks. Imagine if you are the brightest child that you've ever been and you have a full ride scholarship to go to college. But after being in college and you've missed 2 or 3 weeks, now the dean is saying, unfortunately, your scholarship has to be taken. Imagine having your dream job and the job that you absolutely love, waking up to going every day. But after a week or two of missing work, they lay you off. And so now they laid you off. You have an apartment or a house, you have a mortgage that you have to pay for. But now you don't have any income coming in. So now you are homeless and now you're in further crisis. And so when you paint a story to let individuals know how blessed they are, but how over 14,000 individuals living in the state of Georgia, more than 100,000 living in the United States, are going through those type of struggles every day. And we are just asking for you to put one of your children in their shoes, and would you want to do something about it? And they say yes. If you had a child that was suffering every single day and you can help that child in their suffering, would you? And they said, yes. Okay, that's what we need. We need someone to help us with our sickle cell warriors who has a disease from no cause of their own. They didn't do anything to earn this. It's not contagious. You can't catch it, right? You're born with it. And so I plead from the heart. I tell my own story. I have a son who had epilepsy and I did everything that I could do. But guess what? I couldn't save him. But I surely did everything that I could do to try to save him. And so I bring that same energy and that same spirit into sickle cell. And when I look at the sickle cell warriors, and I have 5 that work here at the foundation, and I promise them that I don't care how many times you're in the hospital, I don't care what happens, you will always have employment, because I know how important that is. And as a result of that, we have young adults that came into the company, and here it is 6 years later. They're still employed, they're thriving, been able to purchase their first car, have their own place to stay now, because they have stable employment. Well, I'm not going to fire them because they have sickle cell disease. And so I want to get the message out to all these different corporations around here that are hiring to say, isn't there somewhere we could put this aside that you can put them on staff and not fire them because they're hospitalized? The same thing with schools. When people hear my story and hear why I'm so compassionate and have so much empathy for our story, they want to get involved.
That's incredible. You know, your story is in some ways hopefully just beginning, and you've got a lot more of it to tell. And I think from the bottom of our heart, certainly, I want to express all the gratitude I possibly can for the work you do every single day. It's, of course, a business. And of course, you're a numbers person. And I know that it's probably not easy day to day, keeping people engaged, making sure the lights stay on, right?
Yes.
You've got to keep things going. So the mental, physical, and emotional toll this probably takes on you is immense. But I can tell you the work you're doing is probably the most meaningful work happening in sickle cell disease. So once again, thank you for all you do.
Oh, you're welcome. And I get up every morning feeling fantastic. And I must say, I have such a dynamic team. And so this, of course, is not a solo thing. I could not do it alone. I would not want to do it alone. And it makes it so much easier because of my team. They know what they're doing. They like what they're doing. We all share the same hearts. We share the same compassion, the same empathy. And so it makes it much easier. But yes, it is intensely and can be very taxing, very tiring. But I draw my strength from the Lord. And so I'm strong. And I always say I am fit to fight.
Well, you were certainly built for it. Started from jumping out of planes to
Yes.
helping sickle cell warriors with their pain. That's a great story. Tabatha, I want to thank you for joining Cheat Codes today. And me and Dr. C are going to find a way to come down there and visit you so that we can see the Sickle Cell Sanctuary and spend a little bit of time with your team. If you're a warrior out there hearing this podcast, please subscribe, like our episode, rate it, send us feedback, let us know how we're doing. And if you know somebody who could benefit from this podcast, send it to them. In the meantime, you could follow me at Dr. Z Sickle Cell.
And me at Imagineer.
Until then, take it easy. We'll see you next time. Peace.